Hello and welcome friends, myself Salma Gandhi here to help you for the PSM subject. So in the last class we have started with a communicable diseases, that we have started with the diphtheria. So in that we have seen the introduction, epidemiological determinants including agent factor, host factor and environmental factor. Today we will start with the mode of transmission. Once the person is infected with the disease, he is likely to transmit it to another person. So this disease is transmitted via droplet infection, cutaneous lesions which is infected, and the object used by the patient or the object which is contaminated by the secretion of the patient. So these are the three modes of transmission. Then comes portal of entry. So person receives this infection by two ways, respiratory route and non-respiratory route. In the non-respiratory route, it includes skin, eyes, genitalia and also infants through umbilicus. So these are the portal of entry that this disease is received by a person. Then comes incubation period, right? What is incubation period? It is a period when the person is infected till the onset of sign and symptoms. So what is the incubation period of the diphtheria? Is 2 to 6 days. Now see what is the sign and symptoms, that is the clinical feature. In the clinical feature there are of two types. There are local signs and systemic symptoms. Local signs are seen due to there is formation of the pseudomembrane, and due to exotoxin there are systemic symptoms are produced. Then comes the mild infection, right? In the mild infection we know there is sore throat, running nose, there is insidious onset of the fever, and fever is also of a moderate type. Also there is marked tachycardia. Now do you remember in the last class we have seen the clinical types? So with that clinical types only we'll see the clinical features. First was anterior nasal diphtheria. So in that there is unilateral serosanguineous nasal discharge, that is blood stained nasal discharge can be seen. Second was there is pharyngeal diphtheria. In the pharyngeal diphtheria we see inflammation of the tonsils and pharynx. Also there is formation of the pseudomembrane. On examination of the throat there is mild erythema and exudations can be seen. There is tender lymphadenopathy, and also there is edema over the submandibular area, and due to that we can see bull neck appearance. Then the third was laryngeal diphtheria. In the laryngeal diphtheria it is due to the extension of or sloughing off of the pseudomembrane from pharynx. Due to that extension of the pseudomembrane there is obstruction to the airways, and due to that hoarseness of the voice or the husky voice can be observed. Also there is croupy cough or the brachy cough can be seen. In certain patient we also see there is diphtheria. In certain patient we also see dyspnea, prostration, difficulty in swallowing, in speech, etc. So this was the clinical feature. Then comes the diagnosis. So diagnosis basically done clinically, and we can also confirm this by demonstrating the corynebacterium on methylene blue stain preparation, or we can also do the bacterial culture on the Loeffler medium, also known as ELEC test. After the diagnosis can be done, we can now do the control of the disease. So control can be done by isolation of the patient for the 14 days. Now we'll also prevent, and first of all we'll give the treatment to this patient. So in the treatment there are two people's, cases and carriers. In the cases, before giving the diphtheria antitoxin, we have to go for the sensitization test. So preliminary test is done for sensitization. In that 0.2 ml of diphtheria antitoxin is given subcutaneously to rule out the sensitization. After that, if the person is not sensitized to this diphtheria antitoxin, then the actual dose of the diphtheria antitoxin is given, which is 20,000 to 1 lakh units. It is given intramuscular or intravenously. And in the carrier, we can give erythromycin for 10 days. So after they got the treatment, now there are certain people who is not infected, so we have to prevent them. So we see the prevention. In the prevention, there are certain types of peoples. First, who have received the vaccination or immunization, who have not taken the vaccines, and the third person which are in the close contact with the active cases. So first we will see the immunized person. The person who have received the vaccine within 2 years, those people are not given anything. The person who have taken the vaccine but more than 2 years have been passed, a booster dose is given to them. And the person who have not received the treatment is given the penicillins. And the person who are in close contact with the active case, we can prescribe to them the erythromycin. This was regarding the prevention. Now comes, what are the vaccines we give in diphtheria? So basically we have 3 vaccines: single vaccine, combined vaccine, and last one is the anti-serums, diphtheria anti-serums. So in the single vaccine contains different variants like formal toxoid, purified toxoid of aluminium hydroxide, purified toxoid of the aluminium precipitates, and there are certain many variants as well. In combined vaccine, combined vaccine is DPT and DT. Also there are different variations of these vaccines are available, but DPT is the combination of diphtheria, pertussis and tetanus, or DT, that is diphtheria and tetanus. And the last one is antiserums. So these are the vaccines available for the diphtheria. So that's it for today, guys.